Welcome back to the Public Health Practice Gap, the podcast where we explore the growing divide between what actually improves health outcomes and the systems, institutions, and environments shaping modern life. I am your host, Dr. Bradley Fevrier, and today we are continuing our conversation that I believe is quickly becoming one of the defining public health and organizational challenges of this generation. In our last episode, we explored the attention crisis at the individual level. We looked at how constant stimulation is reshaping behavior, cognition, emotional regulation, relationships, and our baseline mental well-being. But today, we move from the individual to the institution, because the attention economy is no longer just affecting people in their private lives. It has breached the walls of our institutions. It is entering workplaces, schools, healthcare systems, universities. It is fundamentally altering leadership structures and rewriting entire institutional cultures. Today's episode is called The Attention Economy Comes to Work. And here is the central question guiding our next few minutes. What happens when workplaces built for deep work collide with digital systems engineered for constant interruption? Because increasingly, organizations are desperately trying to solve burnout, disengagement, low productivity, and declining morale, while operating inside environments that continuously, relentlessly fragment human attention. And I believe many institutions still do not fully understand the scale of this shift. Let us begin with a simple, visible observation. Most people no longer work in environments designed for concentration. They work in environments designed for responsiveness. Think about the average professional workday today. Picture the screens, email notifications popping up in the corner, Slack messages bouncing in the dock, Microsoft Teams alerts, texts from colleagues, back-to-back video meetings, calendar reminders, dashboard updates, phone notification vibrating on the desk, news alerts, internal messaging systems, a dozen of open browser tabs simultaneously completing tasks. And all of this occurs while workers are still expected to think critically, to solve complex problems, to communicate clearly, remain emotionally regulated, and sustain high-level productivity. That contradiction matters because deep cognitive work and constant interruption are neurologically incompatible. You cannot do deep work in a shallow environment, yet many institutions have completely normalized interruption, mistaking it for efficiency. Here is the irony of the modern corporate landscape. Many organizations claim to value focus while operating systems that continuously destroy it. To understand how we got here, we have to look at the history of labor. Historically, many workplaces were organized around physical labor. If you worked in a factory, we had OSHA standards. We had hard hats. We have environmental controls to protect the physical body from the machinery. But modern economies increasingly depend on cognitive labor, knowledge work, creativity, strategic thinking, communication, emotional intelligence, and sustained concentration. In other words, attention itself has become the primary infrastructure of the modern economy. That is a profound shift, because if attention is now central to organizational performance, then environments that degrade attention becomes operational risks. They are occupational hazards. And yet many institutions still treat attention fragmentation as an individual weakness rather than a systemic issue. Employees are told, manage your time better, be more productive, practice self-care, do some yoga on the weekend. Meanwhile, the environment they step back into on a Monday morning remains completely saturated with interruption. That is not a sustainable model. You cannot out-meditate an environment designed to distract you. We need to recognize something important. The modern workplace does not exist in a vacuum. It is embedded with the broader attention economy, and the broader digital economy profits from engagement, which means workers now operate inside ecosystems, competing for their cognitive bandwidth at all times. Attention is continuously extracted by apps, platforms, notifications, advertising, algorithmic feeds, and digital communication systems. This creates what I call institutional cognitive overload. And over time, overload produces consequences, not only for individuals, though we see that clearly in the mental health data, but for organizational performance itself. This is where the conversation becomes critically important for leadership. Many discussions around burnout focus almost entirely on workload volume. How many hours are they working? How many projects are on their plate? And workload absolutely matters. But overload is not only about the quantity of work, it is also about the fragmentation of attention. Continuous task switching carries massive cognitive cost. Research in cognitive psychology consistently demonstrates that interruption reduces efficiency, destroys concentration, impairs memory retention, and drastically lengthens the time it takes for mental recovery. The brain pays a metabolic price every single time attention is violently redirected. Now, multiply that biological cost across dozens of notifications, endless emails, back-to-back meetings, and fragmented digital workflows. The result is not merely busyness, it is chronic cognitive fatigue. Many workers are not exhausted because they are lazy. They are exhausted because their brains rarely receive uninterrupted recovery. Let's talk about meetings. Modern organizations often confuse activity with productivity. Many workers now spend enormous portions of the day in meetings while simultaneously trying to complete the actual work around those meetings. So what happens? People multitask. They half listen. They respond to emails during Zoom calls. They switch between platforms. They remain cognitively divided for 8 straight hours. Over time, this creates mental exhaustion, shallow engagement, reduced creativity, and ultimately, emotional detachment from the work itself. And importantly, the constant pressure to remain digitally available creates a low-grade chronic stress response. Workers increasingly feel that they are not fully off. And public health should care about that because recovery, psychological and physiological recovery, is a biological necessity. This conversation intersects directly with public health metrics we already track: mental health, sleep hygiene, stress physiology, cardiovascular health, emotional regulation, and social well-being. Continuous connectivity blurs the boundaries between work and home, between productivity and rest, between engagement and overload. Many workers now experience what researchers call perpetual partial attention. Always connected, never fully present, never fully disengaged. The human nervous system was not designed for non-stop activation, which raises a serious question we have to confront. Are we unintentionally designing workplaces that undermine long-term human sustainability? Nowhere is this more relevant or more dangerous than in healthcare. Healthcare workers increasingly navigate electronic medical records, endless documentation, alert fatigue, inbox messages, staffing shortages, administrative overload, and continuous digital workflows. And yet, we continue asking clinicians to maintain deep empathy, clinical precision, compassion, emotional presence, and patient-centered care. That tension matters deeply because attention fragmentation in healthcare is not merely an inconvenience. It affects patients' safety. It affects clinical communication. It drives staggering rates of burnout and workforce turnover. This is exactly why healthcare burnout cannot be understood purely at the individual level. We cannot just tell nurses and doctors to be more resilient. System design matters. The architecture of the workplace is a determinant of health. If today's conversation resonates with you, make sure you subscribe to the Public Health Practice Gap on Spotify, Apple Podcasts, or wherever you listen. And for the written companion to these episodes, subscribe to the Next Gen Public Health Brief newsletter. Every Monday, we explore the systems, environments, and public health trends shaping modern society. Then every Tuesday, we expound those ideas right here on the podcast. You can also learn more about our strategic advising work, consulting, and speaking engagements by visiting nextgenpublichealthconsultancy.com. We help organizations bridge the exact gaps we are talking about today. Now let's continue, because the solution starts with how we view attention itself. I believe organizations are approaching a major turning point. The future of organizational health will increasingly depend on how institutions manage human attention, not just employee satisfaction, not just engagement surveys, attention itself. Because attention influences decision making. It drives creativity. It dictates learning, communication, emotional regulation, and innovation. Without sustained attention, deep work becomes impossible. And without deep work, institutions drift towards a reactive culture, constant urgency, constant responsiveness, constant noise, very little reflection, and very little strategic thinking. This is not sustainable leadership. It is survival mode disguised as workflow. One major issue we have to dismantle is the normalization of instant responsiveness. Many workers now implicitly expect workers to respond immediately to emails, chats, texts, and digital requests. But immediate responsiveness almost always comes at the expense of cognitive depth. Fast communication is not always better communication, and constant accessibility quietly erodes concentration, boundaries, and emotional recovery. We are finally beginning to see forward-thinking organizations ask an important question. What if hyperconnectivity is actually reducing our organizational effectiveness rather than improving it? This is a conversation worth having at the boardroom level. This conversation becomes even more urgent as younger generations enter professional environments. Many younger workers have spent much of their developmental years inside highly stimulating, algorithmically driven digital ecosystems. That does not make them weak. It means their cognitive environment has been fundamentally different from day one. Institutions are going to need to rethink training, communication, workflow design, educational approaches, and attention management strategies. The workplace of the future will require intentional cognitive architecture, not just technological efficiency. The organizations that thrive in the future will not be the ones with the most technology. They will be the ones that best protect human attention. So, what would healthy organization systems actually look like? It's not perfection. It's not a complete technological rejection or going back to typewriters. It is about intentionality. Healthier systems look like protected focus time, fewer unnecessary meetings, healthier communication boundaries, a heavy shift towards asynchronous workflows where an immediate response is not required, reduced notification overload, clearer recovery expectations, and ultimately cultivating cultures that value depth rather than constant urgency. Because sustained performance requires recovery, always-on culture is not infinite performance culture. Eventually, the human nervous system pushes back, and when it does, it looks like a mass exodus of talent. As we wrap up today, I want to make a call to my colleagues in the public health sector. I believe public health increasingly needs to examine cognitive environments. We need to study digital exposure, workplace attention systems, algorithmic influence, and institutional design with the same rigor we apply to clean water and sanitation. Because health is shaped by environments. And today's environment are increasingly digital. We cannot fully understand stress, burnout, mental health, social isolation, or workforce well-being without understanding the massive multi-billion-dollar systems actively competing for human attention. I want to leave you with this final thought. For generations, industrial economies depended heavily on physical labor. We built infrastructure to protect the physical body, but modern societies increasingly depends on cognitive labor. And if cognition becomes central to economic life, then protecting human attention becomes a public health issue. It is a workforce issue. It is a leadership issue. And it is possibly one of the defining institutional challenges of this century. Because ultimately, a society that cannot sustain attention will struggle to sustain empathy. It will struggle to sustain creativity, reflection, collaboration, and long-term thinking itself. And perhaps this is the deepest risk of the attention economy. Not simply distraction, but the gradual erosion of the conditions required for human flourishing. Thank you for listening to the Public Health Practice Gap. If today's episode challenged your thinking, share it. Send it to a colleague, an educator, a healthcare leader, or an organizational professional who is navigating the realities of the digital overload and workplace burnout. And if you haven't already, subscribe to the Next Gen Public Health Brief newsletter for weekly analysis on public health systems, organizational culture, behavioral environments, and the future of prevention. You can find all of that at the nextgenpublichealthconsultancy.com. Until next time, stay thoughtful, stay curious, and continue closing the gap between public health knowledge and public health practice.